Dear friends and colleagues, thanks for coming to IHCA, International Health Charity Association's workshop at AI for Good Global Summit. As the CEO of IHCA, I want to deliver my warmest welcome to all of you. Thanks for coming. Today, we have a wonderful lineup of guests and experts from different fields to talk about the topic of how to empower equal access to healthcare with AI in this age. Without further delay, let me welcome our very first distinguished guest, Ms. Yang Lan.
Thank you. Thank you. Good morning, everyone. Good morning. Okay, as the first speaker, my major task is not to exceed my time limit. I'll try to do that, although there's a lot that I want to share with you. First of all, thank you, Mr. Chen Xingjia, for your invitation for me to be the first speaker for this conference on mental health and for the AI for Good Global Summit. My name is Yang Lan. Some introduction of myself. I'm the chairman of Sun Media Group, a private media company from China, and I was the founder of Sun Future Art Education Foundation, which is a charitable foundation to provide quality art education for rural kids in China. As a TV journalist, I produced the very first documentary series on AI back to 2016. As you remember, that was the year when AlphaGo won the Go match against the Korean Go champion, which was a phenomenon at the time. And it was in that same year I started a global interview and production of a documentary called Explore AI. Ever since then, I have followed closely the development of AI. I have interviewed up to 200 experts in this field around the world. So today, I want to talk about how AI can be used to promote art creativity and also to enhance psychological resilience through art education. Okay, so let's start from this picture. In 2016, when I was interviewing Professor Simon Colton of Falmouth University of UK, the very southern point of UK, he demonstrated a picture that his AI software, which is entitled The Painting Fool, just created, with his prompt as draw a virtual chair. We had a very heated debate at the time. It's about originality of AI. Does AI only copy human creativity? Or it has its original ideas? But we had to agree with each other that this kind of chair, with the choice of its form, its color, its style, had never appeared in human art history. So it depends on how you define originality. The boundary was blurry between machine intelligence and human intelligence, between machine creativity and human creativity. So I decided to collect the first copy of this painting, The Virtual Chair. And guess how much I paid for? No? No guess? £500. Is it worthwhile? I think so. I think so. And actually, here is, here's the picture of Professor Simon Colton and myself holding my copy, my collection. And then, through the last few years, we have witnessed records breaking in auctions for AIGC works. So here we can see the portrait of Edmund de Bellamy, $430,000 US. And every day, the first 5,000 days, $70 million. And along with the emergence of large language model and generative AI, we have witnessed a flourishing of tools for creativity. For example, here is example of a painting made by human and AI together, which is called a Space Opera House with Midjourney, and also short films enabled by OpenAI Sora, which have expanded the boundary of co-creativity between human and machines. We now officially enter an era of art democratization. Gustave Flaubert, the French author, once said, "Science and art are destined to meet at the summit of the mountain after they depart at the foot of the mountain." Actually, throughout human history, we have witnessed again and again that technology and arts meet together when there is, technological breakthroughs such as printing, chemical painting, cameras, gramophone, filmmaking equipment, etc., and etc. They have catalyzed new forms of art in the history of art of human beings. But I think this time AI creativity is very different, significantly different, because it does not only provide a tool for human creativity, but also it has its own kind of creativity. So, like never before, artists and scientists, designers and engineers are working so closely together. Just last month, at the beginning of June, myself and my partners and the team organized a major exhibition in the city in China called Hengqin. It's a part of the city of Zhuhai, very close to the city of Macau. It's called the Hengqin Macau International Digital Art Expo, for which we unprecedentedly invited more than 30 AI companies, technological companies, and also more than 40 art institutions, galleries, and more than 14 internationally renowned digital artists to participate in this exhibition. In this expo. So I want to share with you some of the examples. For example, the first picture is called The Theater of Emotions. As we talk about mental health today, I think this is very significant. It's co-produced by Professor Fei Jun and Chinese Academy of Social Science, the Center of Psychology. So what they do is that they have two sensors that every visitor can hold with your hands, and through detecting and collecting the data of your pulse, about your perspiration, and also your body temperature, it connects and correspond with the AI model of human emotions. So for the first time, you can actually see your emotions in the huge screen ahead of you. They know whether you're excited, you're nervous, you're joyful, you are anxious, you even, if you're depressed. And I think the significance of it is not just for artistic creativity, but also, as scientists and psychologists told me, objective advice or seeing your emotion is the very first step of healing. So you have to identify your emotions first before you can deal with this, before you can manage it. I don't have another picture here, but it's a good example to share. We also have a female artist, Liu Jiayu, working with oceanologists from China. What they did was that they collect data like the temperature of ocean, the speed of water currents, and all these data were fed into an AI model. And they asked the AI model to imagine ocean floor. So what they did is that finally the AI model projected the scenery of ocean floor. Astonishingly, it's quite similar to reality. but it's also with certain imagination in it. It's quite fascinating. So teenagers and young people love to sit in front of that immersive screen for like an hour to see the changing of the visuals. And also here we find that AI is also giving a new potential for art education. Here is a picture from the digital exhibition space of the Palace Museum, 故宫, so that the teenagers, they can play around the 3D models of antiques, so that they can see inside out of all these historical objects, and they can actually hear the music by the musicians in some ancient paintings. But here I want to draw attention to this pair of paintings, which were collected by Mr. Chen himself. This is a pair of painting by children with autism and how they worked with AI. So the picture on the left is a hand-painted picture by a child with autism. And the picture next to it is the co-created piece by him and AI. We know that children with autism sometimes feel difficult to communicate with other human beings, but they are so intuitively talented when they work with AI. And so as a pair of creation, these pictures were auctions to raise fund for charities for children in the Tibet area. So we have a lot of heated discussions about, are we going to be replaced by AI? But we think the more AI is developed, the more important art becomes. Here are some of the parallel comparisons. Like AIGC tend to give answers when humans are good at asking questions. AIGC give you certain certainty, and human GC will provide opportunities for uncertainties. AIGC give you the most probable answer, but human, we are individualized. We have our individual voices and projections of creativity. AIGC can be timeless, but human beings, we live in the context of time and space. AIGC is concentrated on what it can do, but humans would concentrate on what we will do. So it's self-motivation, which is very different. So here I want to show you some of the videos that Sun Future Art Education Foundation did within the last couple of years. It's a foundation we were established 10 years ago. We have reached and benefited more than 300,000 rural children in China. What our concept is not just to teach children how to sing a song, how to dance, or how to paint a picture, not only the knowledge and skills of art creativity, but rather it's about self-esteem. It's about the sense of belonging. It's about communicating with a community and with other people. So here are examples when children were taught to use both technology, AI-empowered, and also hand creativity. So they make clay houses after measuring their own houses and build mathematic models to build a clay house. And they use them to grow green plants, which can be decorated, which can decorate their campus. And also we have the local motifs of a galloping horse as the inspiration. And we used AI to print out 3D models of these horses, and the children would paint with whatever patterns and colors as they like. We find out that in the whole process of creativity, children becoming more confident, they are more willing to communicate with their parents, their family, their villagers, and other children, and they laugh more. I think that that's what matters the most. So to summarize my presentation this morning, I think AI for good is our firm belief. We have to make it for good. AI is empowering a democratization of art creativity, but it should help us to enhance the human connectivity instead of replacing human beings. And above all, it's the purpose, it's the meaning, it's the compassion and connectivity between human beings that will make us to lead the development of AI. So I want to team up with all our partners in this room and outside to make sure that AI is for good. And we want to enhance the mental health and the psychological resilience of our next generation through our partnership. Thank you very much.
Thank you so much, Ms. Yang Lan, for this wonderful presentation and the wonderful projects she initiated. Next, we have a very distinguished guest, Dr. Margaret Chen, but it is a pity that Dr. Chen cannot come here in person today, but she is very generous to send us a video speech. Please take a look.
Dear distinguished guests, colleagues, and friends, good day to all of you. It gives me great pleasure to join you virtually today on this significant occasion. First and foremost, please allow me to extend my heartfelt congratulations to IHCA on your establishment and commend your visionary initiative in bringing together global expertise to leverage technology for health charity. Having dedicated many years to global health, I understand deeply the transformative potential that international cooperation holds for humanity's health and well-being. Collaboration is not merely beneficial, it is essential. The cooperation fostered in Geneva is a testament to the possibility when nations, organizations, and individuals unite behind common goals. Your gathering today continues this proud tradition, echoing Geneva's historical role as a hub of international solidarity and action. Allow me to extend my warmest congratulations to Mr. Chen and his team for establishing the International Health Charity Association. The vision and mission that drives IHCA, combining technical innovation with health charity, promote equity and accessibility, and foster international collaboration, will continue to inspire global health efforts worldwide. Technically, advancements such as artificial intelligence, big data analytics, and telemedicine have dramatically reshaped our landscape of healthcare delivery. Yet technology alone is insufficient, as it does not have a purpose or compassion. It is our responsibility to ensure that these powerful tools are utilized ethically, effectively, and equitably. I am heartened to see IHCA's commitment to driving technology advancements that address health disparity, particularly in under-resourced communities in developing countries. Your summit's theme this year, AI for Empowering Mental Health, is especially inspiring and timely as mental health challenges continue to escalate globally. Leveraging AI provides us with powerful tools that early intervention, improved diagnostics, and wider accessibility to care. Emphasizing mental health through technological innovation aligns perfectly with the global imperatives to achieve health equity. In closing, I commend each of you, practitioners, innovators, policymakers, and advocates for your dedication and foresight. Your collaborative efforts today will undoubtedly ripple outwards, fostering healthier communities, empowering young people, and create a sustainable, inclusive future for all. Let us continue to work together, bridging borders through technology and compassion to build a healthier and more equitable world for all. Thank you.
Although Dr. Chen cannot be here today, but I think her words will inspire us a lot and make a big impact for all of us. Yeah, without further delay, let me introduce the next guest, Mr. Yu Minhong. Please welcome. Thank you.
Distinguished guests and friends, my name's Yu Minhong, Michael Yu, the founder and chairman of New Oriental Education Group in China. My topic today will be how to use AI to solve kids' mental health problems. Over the past 2 decades, maybe 4 decades, China's education has achieved remarkable milestones. Almost 100% of children now have access to primary and secondary schools. And over 50% of high school students enter universities for undergraduate studies. This is undoubtedly a world-recognized achievement, providing a continuous stream of talents for China's future development. I am myself a beneficiary of China's reform. Born in a rural area and my parents are illiterate. My only path before reform was to be a peasant for whole life. But when China reinstated the Gaokao system, that is National Entrance Examination System, in 1977, I became one of the first examinees. With very few universities and fierce competition at that time, I took the exams 3 consecutive years before getting admitted into Peking University, one of top China university, everybody knows. Thus starting a new life that totally changed my life and my destiny. I founded the New Oriental English Training School in 1993, training students for overseas tests to enter famous universities all over the world. Today, New Oriental trains over 1 million students every year, offering comprehensive learning services, including talent training for K-12 students, subject tutoring, and study abroad training and consulting to help thousands of families accompanying their children to grow for their future. Traditional education focused on knowledge indoctrination and exam-oriented learning. Children memorize facts, like when I was in my childhood, scored high on tests, entered elite universities, and then secure a good job. Education used to be all about grades, up to today actually. But this is being upended, like what Yang Lai just said now, by a rapidly changing world and AI system. Many skills we once prized, AI can now perform much better in only 1 second. As the ladder to the future paved by knowledge seems to be reconstructed and even replaced by AI, where should the foundation of our education lie in the future? The pace of change and technological transformation exceeds our imagination and anticipation. Institutionalized systems are rigid and resistant to change for all over these years. And the people can become institutionalized too. The industrialized education system, once very effective for identifying and training talents in batches, has become vulnerable in today's rapidly shifting landscape. Facing such changes, if we fail to keep moving forward, we will not only fall behind the times, but also leave our children at a loss, and even cause significant problems in their physical and mental health, as we have seen already today. This mirrors the current state of education in China. Today, K-12 students still focus on memorizing traditional curricula, and exams remain the sole criterion for selecting students into elite high schools and universities. Elite, so-called elite institutions are judged solely by their ability to produce even higher scoring students, not by fostering talents, hobbies, sound personalities, or the ability to navigate themselves into a changing world. This reality creates enormous learning pressure and psychological anxiety for our children. On the one hand, the number of elite schools is very limited, driving fierce competition as every parent wants their kids to attend. On the other hand, children sacrifice almost all their leisure times and hobby and happiness to become exam machines, suffering great harm to their well-being. This is not just the Chinese issue, but a global one. Squeezed between outdated education system and rapid technological advancements, more children are experiencing physical and mental health problems. Recent studies reveal very worrying trends. 1 in 5 children worldwide faces mental health challenges, from anxiety and depression to lingering trauma effects. Very serious. In China, this ratio is even higher. These issues are not isolated. They directly impact children's ability to concentrate, to form relationships, and to reach their potentials. When we identify problems, complaining helps nothing, of course. The key is solving these problems. For the government, the most important topic-level design is to reconstruct the educational system and the contents of the education. But, as we have said, institutionalized change is very slow and very difficult. Meanwhile, non-governmental forces, including education companies like New Oriental and nonprofits like Henhui Foundation, of course, often identifies root causes and act very promptly. Youngest organization also, readily embracing high-tech solutions like AI, almost including every aspect of students' academic learning and their hobbies. As a non-governmental institution, New Oriental is constantly reflecting and exploring. We realized that mere knowledge transfer is very insufficient. Education must return to its essences, cultivating individuals who possess not only knowledge, but also sound personalities, strong minds, and the ability to pursue their happiness. Thus, in addition to helping students with academic subjects, we also focus on students' mental health, providing support through various means. We initiate much of this work because long before the advent of large AI modules. Today, empowered by AI, we are further exploring how to leverage it for students' holistic growth and mental well-being. In holistic development, we use AI to enable personalized learning, providing precise study plans and tutoring for students' weak points. In language teaching, because we're a language school, basically, We have basically achieved automatic dialogue and error correction system between students and AI, eliminating the shyness that comes with speaking to real teachers. Everybody knows if your language is not so good, then if you want to speak to a real person, you feel shy because you're afraid of making mistakes. But when you are speaking to a machine, it's very easy because you know the machine will not look down upon you, right? So that's what we are doing now. Also, in our scientific innovation lab, students can deepen experiments based on their interest through AI guidance and questioning, unleashing creativity and imagination. We've introduced the Furman learning method via AI, where students explain what they've learned again and again to the machine, to AI, to reinforce their understanding. While education's primary goal is to help students grow, focusing on their emotional and mental health is even more important. We know that only with a positive, healthy, and happy personality will a kid study hard, joyfully, and embrace their future bravely. Driven by this vision, the Oriental Education Foundation and the Henhui Public Welfare Foundation, founded by Mr. Chen Xingjia, joined hands together to launch the Robin Public Welfare Project. Robin is a bird that sings in spring, bringing hope to people. So we hope this project will fly into the hearts of rural children. Especially, we are helping rural children together, like a robin, bringing them warmth and light. We don't just donate money or materials. Of course, we donate money and materials. But we are not only doing that. We believe the key to solving mental health issues lies in education. We organize professional psychologists and volunteers to enter rural schools, offering mental health courses through games, drama, art, more, and more, a lot more. We've personally attended some of these projects, teaching children how to identify emotions, express themselves, and socialize with other students, rather than preaching to students. We provide systematic training for rural teachers, enabling them to become timely mental guardians for children. What role can AI play on this humanistic public welfare path? I believe powerful technology combined with warm humanity together can achieve greater kindness. First, AI can amplify fairness. Professional psychologists are extremely scarce in China, especially in rural areas. Can we use AI to develop preliminary standardized psychological assessment and intervention tools? Of course, yes. Second, AI can boost personalization. Every child's inner world is very unique. AI can assist the teachers in providing targeted care by analyzing learning behavior and emotional feedback, shifting from needle in a haystack, that's what he said, help to the precision irrigation, cultivation. This is just what we are doing, one-to-one. Third, and most importantly, AI must serve connections, not isolations. Using AI should never mean exposing children to cold screens. It should help teachers and the parents understand the children better and create more high-quality opportunities for real human interactions. Thus, New Oriental is investing in the following areas. One is we are establishing emotional recognition early warning mechanisms with AI. What does that mean? We are using AI's multi-module emotional recognition technology to create psychological radars in classrooms and after-school systems. For example, our online classes introduce camera and voice emotion analysis to assess students' emotional status in real time. Of course, while protecting students' privacy, followed by time consulting by real teachers and parents. Second, intervening in academic stress with AI. AI can analyze the practice performance, study durations, sleep data, etc. for students to identify high stress states and provide personalized stress reduction suggestions. So AI sometimes can automatically give suggestions such as reminding students to rest and to listen to relaxing music they like. And third, providing social EQ coaching with AI. Most of adolescents' problems come from interpersonal issues like isolation, poor parent-child communications, and conflict resolution. AI can act as a social simulation coach. We are developing tools that simulate various social scenarios where AI can play the other role in role playing, giving positive feedback on students' responses, helping students practice emotional management and communication skills. Just like what I said, if you are talking or communicating with a machine, there is no problem, no obstacle in their mind. So enhancing the empathy and expression ability. Fourth, designing family education AI assistants. Mainly speaking, we are helping lots of parents with our real teachers, but also with the AI machine assistants. With 20 years of experience in family education, we have done that for more than 20 years. We are creating AI assistants to help parents on communicating strategies and push high quality contents to improve parents' mental health literacy. Not illiteracy, sorry. Of course, while exploring AI's vast potential for kids' mental health, we must exercise caution. AI cannot solve any problem, even cannot solve crucial problems. AI should never fully replace human interactions. While AI offers valuable support, the warmth and understanding of human relationships are irreplaceable. AI should complement traditional mental health services, making them more efficient and accessible. That's why I ask my teachers to contact every student in person, face-to-face, to soothe students' depression or their stress. So let us work together to harness the power of education and technology, navigate the fog of the AI era, and light up the inner light of every child. For when this light is ignited, it not only illuminates their own path, but also converges into a brilliant galaxy that brightens the future of our entire world for kids and for all of us here. Thank you very much.
Thanks so much, Mr. Yu, for his fascinating speech. And actually, I'm not sure if you guys noticed, the slides just accidentally spoil alerted our very next guest. I guess maybe some AI is trying to give us some clues. So without any delay, let's welcome our next guest, Mr. Alex Ng. Thank you.
Good morning, friends, guests. Thank you, Mr. Chen Xingjia, for the kind invitation to speak today to all of you. My name is Alex. I'm currently the president of Tencent Healthcare. Tencent is a very, very big tech group. I think we are well known for gaming, for WeChat, for our cloud and technology services. But today, my talk is going to be on AI in healthcare. And because of this context, I will also add in the title that not all progress feels good within AI in healthcare. I myself, I'm a practicing clinician and a public health specialist by background. So my talk is a little bit traditional in that sense, that I'll talk about sort of the old paradigm, the new era, and more importantly, how we at Tencent actually thinks about this issue with regards to mental health in China. The old paradigm, any good doctor will not have a presentation without numbers and data. At Tencent, sort of my ingoing hypothesis and goal is how can I solve a 1.4 billion problem? And this is the problem of the population. Roughly equal, but definitely more men than women in China. But what do they face? Now, the old traditional way of thinking about sort of many different health problems, one of them is health literacy. Right now, while it is still improving, but as the last sort of official survey by the WHO, the health literacy in China is still around sort of 30%, right? Not great, but definitely improving compared to the ones that was done in 2008. China has developed very well economically, right? As we sort of seen, exemplified by Michael Yu, right? Look, with the reform, we give a lot of opportunity with economic development, educational development, and yet our disease is also very, very developed. Now, this is a map for the clinician out there. We know that this is actually a map of the healthcare burden distribution for China. So the blue shaded color are developed, sort of what we call chronic diseases, cancers, heart diseases. So while our economy is still developing, our healthcare burden is very much developed. If you close your eyes and ask people to guess where their picture will be from, they might say Europe, US, Japan, Korea. But this is the case of China. You would say that we've developed very, very well in that sense into a chronic disease-driven disease burden. Now, what is actually then unique about China is that we are also facing the legacy of the one-child policy issue. Now, this creates a very, very different dynamic where the population, by definition, is shrinking. And it is lopsided compared to the rest of the world. And it is aging going to be much faster than the rest of the world. But from a burden or even mental health, we talk about today, a lot of that falls to within that middle layer, especially the red little figurine. The mother of the family will have to look after the parents, the in-laws, the husband, and one child. And if the Chinese policy is successful, it will not be looking after one child, it will be looking after 2, 3, 4 children. And the immense burden within that middle-aged layer is enormous in this very, very fastly shifting landscape. Now, solution, that is the demand for healthcare. What about the supply? If you look at the number of physicians, we have 4 million doctors in China, quite a vast number. But if you actually spread that over the population that we have today from a ratio point of view, of course, we cannot compare to Switzerland, where we are here today. But I don't think, if you just look at the pure numbers, we're not too bad compared with Japan, our neighbor, Canada, which is also a country that is also geographically very, very sparse, and they have to cover a lot of places, right? And definitely much better than the WHO average for the global, which is 17 physicians per 10,000 population. But however, not all doctors are created equal. Only, you would say, 17% of those doctors will have master level or above education. A lot of the doctors actually are having vocational degree, high school diploma, because these are village doctors. These are doctors in the county hospitals. These are not doctors that graduated from Peking U with 8 years of education, with a formative training that most will recognize as, well, these are the doctors I would like to go to if I have cancer. And I think this dichotomy presents itself a very, very distinct problem. Now, this is the old paradigm, and today we're here to talk about mental health. Mental health, if you look at the burden, it has also increased drastically as one of now going to be the leading, and in the future, definitely the leading health burden within China. Now, what we also see is, depression symptoms. Something on the slides, but the biggest self-reported symptoms high in depression is actually in the youngest age group, in 18 to 24. Now, together with the low intervention rate and the stigma around mental health, I would say that this problem of mental health is even bigger than the traditional mental healthcare system that we face. Now, more numbers. You saw the numbers on doctors per population. Let's take a look at psychiatrists. It's even lower compared with the traditional sense. Like, psychiatrists only account for less than 2% of the total physician base. Now, these are psychiatrists looking after very, very serious mental illness, like schizophrenia, major depression, major anxiety. But a lot of the time, we also need psychologists to actually help with counseling. We have a lot of psychologists in China licensed, 1.3 million of them, but only 50,000 are practicing. It's very, very little. They get the training, but they're not practicing. I'll leave it to you to ponder why. I think the reason is very, very logical and simple. Now, in the new era, what are we in the new era? Where are we living? And Tencent is very much part of the new era. Everybody is on their mobile phone in China. We have pretty much ubiquitous access to the internet. And by far, almost everyone accessing the internet is accessing through the mobile phones rather than desktops. Of course, we have apps everywhere, and the interaction system is also very, very different. Our interaction is not email-based. It's WeChat-based. It's chat-based. And if you look at the online behavior, watching videos, digital payment, shopping online, all those things are quite relatable worldwide. But the only difference is the penetration of usage. I would say that China as a population is highly digitally involved into a core part of our life. Now, what does that bring? For healthcare, this is definitely a double-edged scalpel. On one hand, for healthcare, having everything on the phone enable at least more than 1/3 of people have experienced telemedicine consultation. More than 2/3 has been buying drugs online and delivered to their home. That is an important milestone in creating access, which is a core pillar to universal healthcare. But at the same time, an engaging platform draws in potential scams and fraudsters. I mean, the Chinese word is that this is a famous doctor basically in the name of making money, publicizing things that he shouldn't be publicizing in a very, very public platforms. And with a very, very low health literacy, you can see why this can be a problem. And if it's actually not monitored, regulated, or controlled or studied, it will become an even bigger problem in the future. And the latest trend is actually quite alarming. If you look at online addiction to short videos, these are the amount of time that an average person in China spends scrolling short videos on multiple different platforms, whether it's Douyin, the TikTok in China, Shipinghao from Tencent, or Xiaohongshu, or the Little Red Book. But I think more importantly, it's also you realize that there's quite a lot, almost 1/5 to 1/4 of people say, I want to stop, but cannot. And at the same time, they also feel anxious if they're unable to watch. I think those trends are very, very alarming. And AI companion is not around the corner, it's already here. And whether it's character AI or what is being reported in the US, right? AI companion, if not checked and controlled and studied, could lead to catastrophic devastation to individuals, to families, and to the community. Now, how Tencent is thinking about it, because we are very much part of this digital system, we help create this digital system. I think we have not only the moral, but also the corporate obligation to actually think about what we can do to actually make a difference. Now, back to the traditional era. While mental health is important, I think is every doctor and every patient is important. So within Tencent Healthcare, we try to go from end to end, from how they actually receive information to make sure that they have legitimate peer-reviewed information, to aggregation of services, to providing digital chatbots, agents, and softwares so that doctors offline, not only online, can actually benefit from the AI revolution to make the quality of care better, to improve the efficiency, to actually improve the patient experience, having an integrated online to online workflow when they access healthcare. And also at the other end, how we can actually use platforms like WeChat and WeCom to actually change the paradigm and deliver a new model of care for primary care that is chat-based, enabled by AI, enabled by connectivity to clinical records. Now, this is, again, our solution to traditional sense that we want to augment healthcare by having AI to enable better services. But at the same time, it is impossible. The cat is out of the bag for AI, for Gen AI specifically. In regards to mental health, we are also having a lot of experience. And here, I would say that, first to say that we do not have the solution. But we are very much part of the exploration. On one hand, Yuanbao, which is one of the leading AI apps within China, we have been specifically training the foundational model to have a higher EQ, to be more empathetic. As what Ms. Yang said, right? I think the first way to actually realize what you are is actually to look at your own emotion. And I think at the same time, we're trying to actually make our AI more empathetic and reflective so that the user can begin, right, to better understand the process of the chat. I think secondly, we are also making our current service much more efficient. For the very, very little psychologists and psychiatrists we have in China, and also now healthcare worker, we have been partnering with the official organization to actually fine-tune specific models to enable their work clinically much more efficiently. And at the same time, we are using AI to provide more training, more specialized training to the mental health workers. Now, I think this, to me, is a sharing of a start of a journey on how Tencent want to be and will be part of the solution. But I think, as you can see, the mental health tsunami is only barely starting. With all the trends that I've described before, these are irreversible trends. Whether actually it's the population trends, the youth, the short videos, the engagement in digital platform, I don't see any of those trends turning around magically unless we actually stop using AI. But we know that this is actually not possible. So then the only way forward is actually to engage with the community to try and actually better understand the issue. And I think better understanding of the issue is the start of the solution. So thank you very much for your time.
Thanks so much, Alex, for this wonderful sharing. And without further delay, let me introduce our next guest, Dr. Ken Carswell. Welcome.
Hello, thank you everybody. And I'm glad I'm coming after Dr. Alex because I will also be doing a presentation with data and figures and things like this, also because of my health background. So I want to start really by saying thank you to Mr. Chen and the IHCA for the kind invite to speak here, and also for convening this, because it is a very important opportunity to talk through what is an incredibly important area. So a little bit, firstly, about myself. I work at the World Health Organization in the Department of Mental Health, Brain Health and Substance Use, which we recently became the Department of NCDs and Mental Health. I've been there for about 10 years. I'm a clinical psychologist by background and by training, and I lead our work in the department on digital mental health and innovation. And really what I'm going to be speaking to you about today is to cover a bit of an introduction into some of our work on digital before discussing more the role of AI. So I want to sort of really talk about some of the things that we've developed before moving into what the AI world looks like, what the current world looks like, and also what the future looks like. Now, all of our work is available online. It's open source and open access. And the easiest way to do it is to just search for WHO mental health or WHO psychological interventions. Now, in my presentation, I'm going to be focusing primarily on psychological interventions rather than a lot of our other work that we do at WHO, which includes guidelines, it includes work around prevention of suicide. It includes things like helping adolescents thrive, which is guidelines around promotion and prevention of adolescent mental health problems. But in my talk, I'm going to be focusing more on psychological interventions and particularly digital mental health interventions. And the reason for this is because a lot of the work we do at WHO can be the foundation. We develop tools that are based on evidence. We then test them, and then we release them to the world. So it's very much work that can then be built and further taken forward and further improved. Okay, so firstly, we've talked with other speakers. We've heard a little bit about the context. But just to remind us, across the world, we have a huge mental health treatment gap. So we have many, many people with mental health difficulties, but not enough people to treat them. And no matter what we do, we will never have enough psychologists or psychiatrists or doctors to provide the type of help and support that people need. There are many parts to the solution. At WHO, we talk about task shifting, which is when you train non-specialists to do the jobs of psychologists and similar. So you provide training and support and supervision to help people to deliver the types of interventions psychologists would deliver. We also have digital self-help is also one other aspect where there is extensive evidence. And I think increasingly we're seeing AI. We're seeing many, many solutions as in AI. We're seeing things moving forward in terms of both service delivery, conversational agents and chatbots, drug discovery, early identification. So there are going to be many aspects there. But like I said, in this talk, I want to really focus on self-help and psychological interventions really as a use case for AI and digital. We've known for a long time that self-help can help very well, and we have two forms of it. One form we call unguided, where you have no human involvement, and the other form is guided, where you have some form of human involvement. And some of the documents here are just some of the major evidence reviews around this. So in our own guidelines at WHO, we recommend self-help for primarily common mental health conditions like depression and anxiety, but also for things like substance use, for some aspects of suicide prevention, and so on. When we look at all the studies that have been done around the world and we put them all together, we see some certain themes and trends. We see that digital self-help interventions can be as powerful as human-delivered interventions. We see that guided interventions and unguided interventions are both useful, but generally we see that guided interventions, so those with human support, are more effective for people with more severe conditions. And we also see that these types of interventions can work in countries of any income level. And the other important thing to mention is that self-help isn't just for people who have mild problems, but it's really for people with a range of different issues and more severe issues. So I see I've only got about 5 minutes left, so I'm going to jump through some of the slides. At WHO, we've been developing a range of digital mental health and non-digital interventions. And these are the interventions here. And as you can see, they go from low resource intensity to high. And down at this end here are our self-help interventions. And all of these have been tested in at least 2 randomized controlled trials in different places around the world, normally in conflict settings or areas affected by severe adversity. We also then have things like a psychological intervention manual, which helps people to implement these. There's a big chapter in there on adaptation. Now these interventions, which I won't go into in detail, basically use characters, fictional stories, and similar to provide training in stress management or skills to help with depression and similar. And we combine these interventions when we do a guided version with a guided self-help model, where the person receives 15 minutes of weekly telephone support or message support once a week. And these things can be used across different interventions. The model is very easy to adapt. And there's a big focus on coaching, motivation, and support. So through these sorts of interventions, we can already reduce the need for time with a healthcare worker. And we see these interventions working very effectively at scale. So we have seen, we've conducted multiple randomized controlled trials on them. We see that they work in different countries. We also see large reductions in depression and anxiety. And we've also now seen these interventions being scaled in many places, including Lebanon and Thailand. And like I was mentioning, the work we do at WHO can be adapted. So colleagues in India took one of our programs and have adapted it for WhatsApp because it's all there as open access. We have a third intervention in development where we recently conducted and completed an RCT that was super exciting. And this is a chatbot called STARS. Now, it's a non-AI chatbot, but the results we got from it were hugely impressive. We got huge engagement of about 65%, people completing on average about 7 sessions out of the 10. And we saw massive reductions in depression and anxiety, particularly also for people with more severe problems. So all of this is out there, and I guess one of my messages to everybody here is that it's evidence-based. And we've tested it, we've tried it in different countries, and it's all there to be used by people and made more beautiful, more engaging by technologists and others in this room. So I'll just mention a little bit on AI and mental health. So obviously at WHO, there is a lot that we're doing outside of the mental health field on AI, and these are some of the publications from colleagues in the Digital Health and Innovation department. We are seeing increasingly evidence coming out for AI interventions being effective. We're seeing conversational agents or chatbots, randomized controlled trials of them showing that they're very effective for mental health. And we're also sort of seeing things develop in terms of other areas, such as diagnostics. But I wanted to mention a little bit about some lessons from the past for us all. I think when we think back over the last 10 to 15 years in terms of digital development and digital technologies, we see some things that we can change moving forward with AI. So we've seen, for example, in app stores, there are many, many self-help apps, but few of them, or most of them, have not been tested. So we don't know if they work. We don't know if they're helpful or harmful. We see that the evidence-based interventions don't really make it to market. They don't make it into people's hands. And we also see a substantial debate about the impacts of digital technologies on mental health. So, you know, there are obviously many concerns about the impacts of social media and other aspects of technology on mental health, as have been mentioned. So in addressing this, you know, this is why events like this are so fantastic, because in addressing this, I'd like to see us move forward in the world really in a collaborative way, and in a way that improves partnership. And one of those key aspects, I think, of collaboration is around research. And this is a recent paper by Professor John Torres. And the sentiment I agree with very much, that AI is very exceptional in terms of a technology, and it's probably the most powerful thing we've seen happen. But what we know from past history of health innovations is that research is key, and building that research in really, really early so that we can understand, does it work? Who does it work for? How do we scale it? How do we implement it into a health system? And what are some of the unintended consequences or effects? If we can build all of that in now, then it means that I think moving forward in 10 years' time, we'll have a much better understanding of what's happening. So I guess really just in closing, my main thing is really for us all to think about how we build the foundation for rigorous state-of-the-art research around AI. And I think that will take collaboration between researchers, health professionals, technologists, governments, and many others. So thank you for your time.
Thanks so much, Ken, for this amazing sharing. So our next guest is the founder of IHCA. Let's welcome Mr. Chen Xingjia.
Okay. Distinguished guests, esteemed colleagues, ladies and gentlemen, thank you all for joining us. Especially, I want to say thank you to all of friends who stand in the meeting room. So thank you so much. You inspired us. Okay, thank you. Today, I would like to begin with a true and a sort of provoking story. Not long ago, a mother sent us a message. My daughter is 15. She used to tell me everything, but now she comes home and just locks herself in her room. When I try to talk to her, she always says, "You don't understand." As a mother, I feel truly heartbroken and helpless. This individual story, in fact, reflects a much larger global challenge, the global mental health crisis and the human cost behind the numbers. According to the World Health Organization, nearly 1 billion people worldwide are living with some form of mental health condition. Among them, the most concerning group is our next generation. In China, there are 215 million adolescents, and many of them at a critical stage of their development are struggling with growing pains, of anxiety, depression, and loneliness. This is not a topic we can afford to dismiss lightly. It's an increasingly severe worldwide social phenomenon. Behind the crisis lies a profound structural paradox. On one side, an ocean of demand for mental health services. On the other, a desert of professional supply. When children face psychological distress, their parents often don't know what to do. Hospitals might say the child isn't clinically ill. Private counselors are expensive, and online information is overwhelming and unreliable. In this vast gray area of not knowing what to do, countless families are silently burning confusion and pain. After in-depth research into thousands of family cases, we uncovered a hopeful discovery. 90% of adolescent mental health issues can find their solution in improving family communication. The problem isn't a lack of love, but the way love is expressed. When a 15-year-old girl says, "You don't understand me," what she might truly be trying to say is, "Mom, I need you to understand how I feel right now." The family is where healing begins and where strength is found. Facing this discovery and this opportunity, we are creating an accessible AI product, the Xingjia AI Family Mental Health Coach, which is built on 3 core benefits. The first is let love flow by building a family support system. The name Xingjia carries 2,000 years of Chinese wisdom from the classic phrase, cultivating the self, harmonize the family, govern the state, and bring peace to the world. In Chinese, 修身齐家治国平天下. Today, the meaning of Xingjia is to help every family become a warm harbor, allowing love to flow freely among its members. Why the family and not just individuals? Because we found that 90% of youth mental health challenges are linked to family communication. Instead of leaving a child to face their struggles alone, it's far more effective for the entire family to grow together. Our second belief, prevention is better than cure. We focus on a neglected group, families whose children are having some issues but aren't seriously ill. When they go to a hospital, doctors say there is no clinical diagnosis. When they look for a counselor, the costs are too high and the waiting lists are too long. This vast gray area, what we call a state of family psychological sub-health, is the core population we aim to serve. We hope to provide professional guidance and warm companionship at the first sign of a problem, building psychological resilience within the family and preventing minor issues from becoming major crises. Our third belief, free, non-profit, and open source. Make mental health support a universal right. We firmly believe that basic mental health support should no longer be a luxury or a privilege. To live up to this conviction, we have made the most radical choice from the very beginning. We are completely free. We will never charge any user for our services. We are a non-profit organization. We are not driven by profit, ensuring that all our decisions are made solely for the well-being of our users. And we will open source our core achievements, inviting the world's wisdom to participate and co-create with us. To realize these ideals, we must solve 2 very important problems. First, what defines good psychological counseling? we have established a collaborative online platform for our AI evaluation model, inviting psychologists from across the country to work together. The standards are completely open, and the process is fully traceable. We currently have 10 psychologists participating and will soon expand to 100. We have identified 5 crucial dimensions for AI mental health assessment: empathy, positive feedback, goal alignment, collaboration, and emotional connection. Defining what constitutes good counseling requires broad consensus around human experts. Our quality standard is for our AI model to achieve over 80% alignment with the consensus of these human psychologists and all dimensions. Second, how do we build the best AI mental health product? We have created the Xingjia AI open source collaboration platform. This is the world's first open arena for AI prompt optimization. It is completely open source and permissionless, allowing prompt engineers from anywhere in the world to participate. We will also directly invite engineers from fundamental large language model teams to contribute. The highest scoring prompts will be integrated into our Xingjia AI Family Mental Health Coach app. This open source platform will operate in real time, allowing us to regularly update our product as new model versions are released or BERT prompt optimization techniques emerge. Since our launch in February of this year, we have completed 8 rounds of closed development, and the internal beta version of our product is now live. We are meticulously polishing the Xingjia AI Coach with a design philosophy that is easy to use and warm and professional. Our vision is for Xingjia AI to become an home assistant for every family, offering special advice when a parent doesn't know how to communicate with their child. Help them understand their child's inner world when they feel confused by their behavior, and providing professional support and companionship when they feel anxious and helpless. But a great product idea is not enough. We also need a new organizational model to achieve it. Together with my non-profit partners, Zhao Yi and Kai Fu, I co-founded the Intelligent for Good social innovation network in Hangzhou, China. We have chosen an unconventional path: no shareholders, no employees, and no monetary incentives. Driven by pure idealism, we are dedicated to activate the cognitive surplus of professional volunteers. We are building not just an organization, but an open and transparent online collaboration platform that enables professional volunteers from around the globe to contribute in a no-barrier, tidal, and sustainable manner. Today, we have already brought together over 50 volunteer psychologists and more than 20 top-tier AI engineers from across the world. They are using their professional knowledge and their compassion to make Xingjia AI more understanding, warmer, and more professional. We are especially eager to partner with global technology leaders. We hope to collaborate together through initiatives like hackathons and donations of computing power. Whether you are a parent concerned about your child's growth, a professional psychologist, a technology expert, decision maker at a tech company, or simply a person who cares about this world, we invite you to join us. Contribute your warmth to the world in your own way. We promised to be forever free so that no family is denied help for economic reasons. Forever professional, ensuring every piece of advice is expertly validated. Forever warm, using technology to convey human care. Forever open, inviting the world's wisdom to co-create with us. Our vision is to use Xingjia to help 10 million families build their own support system, providing free, accessible, warm, and professional mental health services for every family in need. this is not a perfect world, but it is one we love so deeply. This is an arduous road waiting for us to cross it together. Thank you.
Thanks so much, Mr. Chen Xingjia, for this very passionate speech. And next, we actually will have a roundtable discussion, and I will have the luxury to talk to the distinguished guests and exchange our ideas. So let's welcome the guests on stage. Let's welcome Mr. Alex, Karina, Ken, and Professor Zhang. Welcome, everyone. So, Alex, Alex and Ken have already spoken, so I think you get to know them. Let me introduce the other two speakers. Professor Zhang Min. She's from the Vanke Public Health School of Tsinghua University. Let's give her some welcome. And Ms. Karina Michel, she's the Chief Creative and Technology Officer of the NGO Grow Effect. Let's welcome her. Yeah. So firstly, I think I will open with some general questions for.
Sorry to interrupt. 常宇，也许每个人往前坐一点点 ，move a little bit ahead. Otherwise, the light is coming. You are so nimble. Yes.
Yeah. Now everybody's witness that can access it a lot. Okay. Yeah, I think we're ready. So I will start by throwing some general questions for everyone if they want to jump in or comment on each other. So I think let's start by asking something more in an optimistic note. So what excites you most about the potential of AI in transforming healthcare? Any of that?
Yeah, I'll go first. Just a little bit about Girl Effect to give context on my answer. So Girl Effect works with teenagers and adolescents, and we work predominantly around sub-Saharan Africa and India, and we deliver a lot of mental health, sexual health interventions. And what we have seen in the 10 years that we've been working with teenagers is that a lot of them lack entry points into healthcare systems. They don't feel inspired, they don't see the importance of engaging with their health. And so what we've seen in the last 8 years in which we've been leveraging AI is that it's quite powerful in addressing their needs. We deliver chatbot interventions, we work with teenagers on the ground. And in context in largely sub-Saharan Africa, we're working in fragile health ecosystems where I think many of the keynotes have talked about the lack of clinicians, psychiatrists, and psychologists. And we are seeing mental health grow exponentially amongst adolescents. And Africa is going to become the largest population, the largest healthcare market in the next 10 years. I think with AI, it's quite critical for them to be able to grow and address those needs. I think it's quite important to unlock that potential and see that happen.
Yeah, thanks, Karina. Anyone else want to jump in?
Yeah, I'm happy to say something. I mean, I said some of it in the talk, but I think for me, one of the biggest excitements about AI is the range of different areas where it can apply. So we're thinking about drug discovery, conversational agents, and aspects like that. All these different aspects where it can apply. So it does have the potential, I think, to scale up and support mental health services. Particularly when it comes to human or person-delivered aspects, I think we also need to be realistic, as we've heard from many speakers, that it can play a role, but it also needs to play a role as part of a system, and also to have the human involved. So there will be many people who, even with support from a conversational agent or other form of AI agent, we'll still need more. You know, we need to still keep the focus on a comprehensive mental health system, particularly for people with more severe conditions. So we've got to think across the whole range, but I certainly see how it can help us reach more people, because we have a huge problem.
Yeah, thanks, Kim. That actually really leads well to my next question. So my next question is, where do you see the largest gaps between the potential of AI in transforming healthcare and the reality of what is currently being implemented? Maybe Professor Zhang wants to share.
I think there are several challenges in turning the promise of AI into real impact. I think to me, the biggest gap lies in data, because AI tools rely on high quality data, and in terms of both size and quality. But many AI tools, they are trained on perhaps limited data, or either of low quality or smaller sample size, or a homogeneous subgroup of patients. They're not representative of the diversity in real world patients. So I think without comprehensive and high quality and representative data, so AI tools cannot perform reliably across different settings. And so this would raise concerns over bias, fear, and generalizability.
Thank you.
And I'll just add to it, sort of the gap, because within healthcare, we always have the impossible triangle of improving access, quality, and controlling the costs. I think with history, the ongoing as every single new technology also bring with it a lot more costs. So the health system has been going about improving quality in the name of cost. And I think with AI, we can actually address a lot of this. And just to echo Professor Zhang's point, I think AI can definitely solve the access issue. And the current generation of Gen AI, the cost will only reduce and decrease compared to the older generation of AI. But I think this is actually the quality aspect. I think this is where there isn't benchmark, there isn't a good validation because of the lack of data, the lack of study. And in order for sort of the system academic, for us to generate the data, to study it, to validate it, how effective this is our way of being doing things for many, many years. But I think the issue that we'll be facing is the internet is very democratic. For every validated apps or solution that we churn out, there will be 10,000 invalidated apps that's being published by individual, by organization. And then I think this is also, we in this very, very mixed ecosystem that is very, very confusing for the user. Where the more serious one to make sure that this is effective tend to be very, very slow by the nature of the design. And I think this is actually the potential where AI is generating a lot more of these solutions, but at the same time, it brings with a lot of baggage, right? That we will only see the downside of it a few years down the line. And sometimes I also feel saddened by this, is that by the time we can see it happening, but by the time we get there, it's a little bit too late.
Yeah, that is very well said. That actually also leads to my next question, because we all know that although AI is rapidly evolving every day, but there's also a great disparity when it comes to who has access to that, and especially in developing countries, in low to middle income countries, they may not have the access to the top tier service. So what do you think what we can do to ensure the more equal access, especially in those areas? For anyone who wants to.
Yeah, I think a lot of the challenges that we're seeing, and there's been mention of it, is that in the context of LMICs, there's a real lack, especially with language models, around the languages of marginalized populations. There's a lot of studies coming out around low resource languages being 20% less efficient than most languages that are predominantly English based or Western based. So that raises huge costs around being able to reach these audiences, because those models that we can do are usually token dense. The amount of cost of using them are sometimes 4 to 5 times more expensive than if we were to design solutions in high resource languages. The other thing that we also notice is that we're seeing a lot of AI solutions that are designed for high income contexts. We see a lot of apps, but there are still billions of people offline. And those that can most benefit from these technologies, they don't have that access point via data-enabled phones. I get really quite excited when I see organizations like Jacaranda Health or VMO who are designing AI to live on lo-fi channels like SMS and voice. They're addressing literacy issues, or addressing affordability issues. So yeah, I think those are potential avenues where we're seeing that promise of AI potentially be realized. But I think, going to your question, there's still a huge lack of research on these initiatives, both on the AI front and when it's applied in these contexts. So I think there needs to be a lot more investment into the research and evidence base of how AI is truly contributing to outcomes.
Thanks, Karina. Now that we have done some warm-ups of general questions, let me go into more like one-on-one targeted questions section. So if I may, I want to throw some questions at Professor Zhang first. I know that you work with very large data sets of health in your research. So for just like regular people, how do you understand how we can turn this big data in healthcare into more helpful health decisions?
Thank you very much for the question. So I think we all have seen AI has great promise, and we have seen many very cool AI tools. But I would like to mention that underlying all those AI tools are really boring data analytics. So AI has different meaning to different person. Like to me, I'm a data scientist working with many complex health-related data. So AI to me is a powerful and modern toolbox that can help extract meaningful insight from data. And it can help us to develop AI tools. And so to give you some concrete example, so I work a lot with national registry data, clinical registry data. For example, one data I work with a lot is ventricular assist device for advanced heart failure. That is a device put into your heart. So, so in this national registry, it tracks almost all FDA approved devices over the last 20 years in the US. And we collect a lot of data like information before the implantation, information after implantation, like adverse events, stroke, bleeding, pneumonia, infections, and quality of life, right? But without powerful AI tools and analytical tools, so those rich data set would remain just a collection of scattered information, but not actionable knowledge. So the AI tools can help us to ask critical questions. For example, what would happen to a patient after the implantation of the device? What is the risk of dying within like 30 days, 6 months, or 1 year? So we can build prediction models to stratify patient, whether high-risk patient or low-risk patient. And also, we can answer questions like, say, what kind of patient they would more likely to have bleeding, and what is the effect of bleeding or mortality. And also the effect of bleeding, they may change with time. So all these questions are very useful in supporting clinical decision making. Yeah.
Thank you so much for the explanation. Also, I know that your work concerns a lot about like cause and effect of data. Like for example, whether the device is working, whether medicine is working. It concerns like this cause effect analysis. So my question is for example, AI mental health intervention, AI chatbot. How do we figure out whether it's working or not?
Yeah, that is a great question because so ultimately in all scientific inquiry, understanding cause and effect is very important. And especially knowing whether AI intervention works or not is very important. I think one speaker has mentioned that right now many of tools, there's little evidence to support whether it is effective or not. So So this is really a causal question, not an association question. So we all know that, for example, the ice cream sales are associated with Zhang Min instance. But we all know that reducing the ice cream sales will not reduce Zhang Min instance, right? So that is a causal pattern. So AI so to really understand this question, we are asking a causal question. So what would have happened if a patient had not received the AI intervention? So there is a field called causal inferences. That is a field dedicated to answer this type of questions. So there are many tools available. For example, the standard method is randomized trials. A challenge in AI mental health intervention is that many of the interventions, they are personalized. So different people receive different treatment. And also it's dynamic. So the treatment may change with time. So which means many of the traditional trials, they would not work in this setting because those tools are developed for comparing a few number of interventions. So for this type of comparison, we really need calls for innovative study designs and new causal inference methodologies.
Thanks, Professor Zhang, with this very vivid example of illustrating that. Since you work at a very prestigious institution, Tsinghua University, I also want to ask, what do you think the role universities and academic institutions can play in developing safer AI health tools?
Yeah, I think we all see that AI holds great promise, and we have seen many successful stories in many areas. But it is not yet a mature technology ready for widespread use in healthcare yet. So I think our speaker has already answered my question because in AI research, collaboration and research are essential. And universities are well positioned in leading this kind of innovative, deep, and rigorous research. So I think a lot of foundational research is still needed in order for AI to deliver the promise.
Thanks so much for Professor Zhang's explanation. Let's let Professor Zhang catch some breath, and I can go on to the next guest. So let me ask Karina. So we all know that the Grow effect reached millions of users across Africa, Asia through health chatbots. So there's a vast diversity of users. How do you design to make the chatbots more relatable to this, especially for your users, mostly teenage girls?
Yeah, well, first I'll say is that a lot of our solutions weren't started as chatbots or AI. A lot of this work dates back over a decade in which we were delivering a lot of analog solutions like magazines and radio dramas, in which we tapped into this deep unmet need that adolescents and teenagers had about growing up, and that they felt like they didn't have a judgment-free space to talk about some of the issues. And over time, we've been leveraging technology to scale and answer those questions of teenagers. And through the 10 years, we've spoken to thousands of teenagers and come to understand what it is that they find relatable, what do they resonate with, what are the commonly asked questions that teenagers around the world have, which surprisingly are really quite similar no matter where you are at. You know, body curiosity, love and relationships, healthy relationships. And so what we want to do is to continue to work with teenagers and co-create all of our products with them, and not in a very extractive, let's do a focus group, tell us what color you like. We create youth advisor panels in which teenagers graduate and grow with us over time, where they can see how their inputs are developing the products, and they can, feel that they are not just sharing something and having an expectation that something will happen. They get to see that happen. And I think through those deep human-centered practices, we're able to create a product that is emotionally resonant for teenagers. I mean, today we're reaching 2 million with our chatbots, and we answer 80,000 questions daily. And I think a lot of that, why are they going to us and not GPT, And I think it's because we've built our models to speak in the tone, the dialects that young people speak across multiple countries and cultures.
That is very well said. I think a lot of keynote speakers have mentioned about now it's almost inevitable to have people talk to machines, talk to algorithms, but it is really important to make it feel relatable, not just like cold-hearted machine, right? So my next question for Karina is that we know that Grow Effect is not only in developing AI product yourself, you are also helping shaping ethical guidelines of how to develop like AI-powered behavioral and social change tools. So can you talk more about that? How do you shape and who do you work with in developing these ethical guidelines?
Yeah, absolutely. When we started to look at the advancements in AI with the release of ChatGPT over a year ago, we started to test them and see how powerful they were. But we also understood that there was a lot of risks associated with using these models, you know, the bias, the potential hallucinations, and risks associated with AI companionship, you know, young people developing relationships with bots that may sound like they're emotionally connecting to you, but they're not real individuals. And in the context of mental health, having an understanding of what is it as a small NGO we can service and support young people with, but we have a duty of care. We're not psychiatrists, we're not psychologists. We can intervene early, but we really need, because AI is not good at this, human intervention at key moments in engaging with young people. And so we put together a draft ethical guideline. And so oftentimes, guidelines and policies tend to sit on the shelf. It's not really used. They're kind of promoted, but they're not designed to be practical. And so we set out to work with experts in digital safeguarding, mental health experts, and technologists to create a practical guideline to ethical use of AI. And we set it out, and we tested it ourselves. So we spent a year applying those guidelines, iterating those guidelines, and those guidelines are shaped by young people themselves. They were also using the guidelines, and they would tell us, how can this be more accessible to a young person? And over time, we were able to release that as a public good benefit so that other organizations who are excited about AI are also aware of, you know, we like to talk about paranoid optimism. AI is really powerful, but we want everyone to be aware and learn from Girl Effect on the things that we discovered in our journey of leveraging these models.
Yeah, thank you. I think, as you mentioned, although sometimes ethical guidelines can be hard to enforce or hard to get everyone on board, but I think sometimes it starts with like a discussion like today, right? The dialogues, sometimes we maybe have arguments, maybe we have consensus, but later it will develop into a framework that everybody can sort of maybe agree on and we can act on it. So my next question for Karina is that we also know that the Grow Effect is also running on apps like WhatsApp, like Facebook Messenger. It's basically the counterpart of the WeChat as we have in China. And why choose these platforms, and what are the benefits and limitations that impose?
Yeah, we go where young people are. And in contexts where there's high mobile penetration and young people are on social media, it's not effective to try and take them out of that world and send them to another place. If they're already on WhatsApp, they've already made the decisions of what they can afford, what channels are accessible to them. And so we live on WhatsApp, and in South Africa we live on Moya, which are free-to-access platforms to engage with our chatbots. But it's also important to recognize we don't just do chatbots. Yes, we reached 2 million young people on WhatsApp-based chatbots, but we reached 45 million young people last year through many multi-models of community engagement and working with schools and working with governments. There are moments in which chatbots and AI can be really effective, but to really address some of these complex issues, it's not a single solution. It's not a one solution fits all type problem. Yeah.
Yeah. Thanks, Karina, for the very patient and informative clarification. Let me find my next victim. Let me go to Alex. So, Alex, you talk about like the AI health tools Tencent develop. I'm wondering, since we talk about with Professor Zhang about the evaluation problems, like how we know if it's working. So I want to ask, like, from Tencent's perspective, what are the metrics that matter most in terms of evaluating if they work or not?
I would separate sort of the evaluation based on two different types. I think the way that in the traditional paradigm, in terms of augmenting the workflow, I think it is very, very hard to evaluate them if you put the workflow end to end, because there's so many steps being in place. So we are very, very purposeful in ensuring that our evaluation is basically we can actually find causation and we have a good comparison group. For example, some of the triaging, the pre-consultation history-taking chatbots, right? What we do is the metrics that we actually look at, one, I think is the actual productivity improvement, because with the supply and demand gap, I think that is one of the most acute. I think then secondly, what we actually compare is that when a consultation is actually with the information that's augmented by the AI, what is then actually the actually serve a perceived improvement on the quality of the consultation by the doctor and also by the patient. Now, I don't have the exact data, but I think qualitatively the anecdotal evidence is that because the way that the Chinese healthcare system is set up, most doctors do not spend enough time with the patient. Even with AI, we cannot make up time. When they have 3 minutes per outpatient consultation, they will still have 3 minutes per consultation. But what happens is with the AI augmented sort of discussion and history taking beforehand, the patient felt that because that conversation has been looked at and confirmed by the physician during the consultation, they felt that they have been listened to. They felt that the doctor, because of that, are delivering more quote-unquote professional services to them. And then the doctor, through a survey, told us that, well, the patient are actually a lot more patient with them. But actual fact is all perception. The actual time that they have with the doctor is exactly the same as before, in a setting that is probably just as chaotic as before. But I think here, this is what helps, because I think for those who have worked in China will understand that the doctor-patient relationship is often very, very tense. Which can lead to lots of conflict. And I think that alone sort of de-escalates this, right? I mean, this is, I think, one of the classical ways of comparing and contrast. And now, we haven't done this intervention at mental health, as I just explained, because I think we want to be very, very cautious before jumping to any solution, that we actually want to understand what is the state of probably the situation, not necessarily the problem. And I think from a tech company standpoint, we have one of the most engaging AI app. Now, the KPI for those teams will be on user download, user use, engagement time. Now, those maybe for general, like not just for AI mental health, right? Maybe for you to practice your homework, answering questions, doing search. But that's what ultimately tech company will have the same similar goal of driving towards usage time and usage frequency. But that will have its downside, as we can all understand. So we are actually doing very, very detailed analytics, right, to basically understand our user base, especially when it comes to healthcare-related question. How much of that is actually, well, how do I take aspirin, right? Well, those are more factual answer. How much of that is, well, is heading into emotional sharing, and how does the conversation come across? So I think right now we are still at the stage of just understanding our user base in this very, very changing environment. Because I think once we've laid the groundwork and understanding the baseline, then if we want to do experiments of potential not intervention but augmentation, then we can actually have a much more accurate understanding of not only on a user but on a population basis. Because like Professor Zhang said, we're in uncharted territory. Like we cannot go onto the old traditional placebo-controlled randomized control trial in addressing AI, right? It might be a combination of time series and real-time studies with real-time segmentations, right, of subpopulation groups, and look at the deviation from baseline and from the norm, right? So I think this is where we're heading. I think it's a fascinating, I think both academically, but I think we are also treating it with a lot of caution. Because I think if we try to jump into intervention without understanding the baseline, then we don't know whether we are okay or not.
Yeah. That is a very, very good point. That in this uncharted territory, we cannot just apply the old playbook, just like you said, in terms of how tech companies evaluating its outcomes. And my next question for Alex is that we know that for Tencent, you integrate like AI and the WeChat with for example, public hospitals and other maybe private health systems. So in this integration, is there any technical or regulatory barriers exist?
A lot of barriers. I don't think we have enough time to talk about all of this, right? But I think this is it's actually very, very common worldwide, right? What's happening in China, that each hospital system, each hospital has their own system, has their own standard. It's not interoperable. It's not cutting across. So a lot of the work, right, it cannot be as easily scalable as it would be if everything's under our control within Tencent, because we have to work with the industry. I think the same is true for many, many geographies, right? I think this is where access from that point of view is slow. Because even though we have very validated AI, but like spreading it across the health system, and when it comes to equal access on top of health equity, just the way the economics play, it will be the large hospital in the big cities will have the financial means to start adopting, and not just buying and adopting these services, but also provide the necessary training and change management for the staff to actually use it properly, to measure the output properly. And then when it comes to the rural area, I mean, this is where it's actually deficient. And so that's why at Tencent, we also have this internal drive, right? For those places where they truly cannot afford it, right? We will almost give the solution in kind to actually help them adopt and help them use it, right? It's almost to the effect that, yes, internally, we are using the rich countries and the rich counties, the rich hospital, the rich city to subsidize the rural area. Because I think this is the only way that we can have a control in actually try to reduce the health inequality across the city and rural divide.
Thanks so much for the clarification. So my next question actually could be a question that every tech company on the world gets asked 1,000 times. But today I'll ask it again, which is about data privacy. A lot of users, when they are using like AI chatbots, like the first thing, maybe one of the first concerns they have in mind is like, what if Tencent get to know all about me, get hold of all my data? And that is quite a legitimate concern. So from Tencent's perspective, how do you ensure that the data privacy is addressed?
So I'll answer the question in two separate aspects. I think the first aspect, as you mentioned, we have been working with hospitals, institutions, doctors, to provide them with AI software. Now, those software is actually deployed within the hospital's information system. It's deployed with the doctors in mind. So those data, we just provide in some way the software. The chat log and all the history of that actually resides within the hospital themselves, and they manage it, right? And so, because those are very, very professional data, like we don't intervene. Now, then your question, I think, is what most people want to understand as well. If we're chatting to Yuanbao, it's like if you're chatting to ChatGPT, right? Would that, what do you do with the data, right? And what do you do? So in some way, I think it's public education. It is impossible for us to provide the service if we do not store any data about any of our user. That is sort of very counterintuitive. It's also like what Michael, you with the old traditional sense of education, right? Like, well, you know my test score, right? But how do you ensure that like this is not leaked? Like, I have to know you before I can serve you. But then I think what we do is I think this is where I'm really glad like at least the government of China actually put out what we call PIPL, right? Like personal information privacy law, right? Because then it does level the playing field, right? We know exactly what is required of us to protect user data, right? So that we do not actually collect more than necessary data to deliver our own service. Because even before that, every company sort of like will have to look internally, right? What do we do with the data? Like some will do more, some will do less, but then it's actually not systematic. So I think just like the Europe with GDPR, right? Or with the US around healthcare, we've got the HIPAA regulation, right? That's why I think having a detailed implementable regulation is actually quite important for tech companies. At least for tech companies, we'll be first one to put a hand up. Please just tell us exactly like what is required of us, right? Sometimes it's actually even worse for us if you leave a question mark, because then we are in a bind. If we are more conservative, we are more worried, then we will worry that we might lose out in a competition and battle against other tech company, which might be more risk-taking, and while we are more risk-averse, right? So I think this is where that regulation, to me, I think it has to evolve, because that regulation is still, to me, about the old traditional way of looking at data privacy. And the new Gen AI, I think it requires a new separate sort of AI regulation regarding data, regarding usage, and regarding dissemination.
Yeah, thanks so much. I think it also goes back to our discussion with Karina about the ethical guidelines. I think that in this age, it's really important to have both ethical and legal and regulatory guidelines, so that everybody can know like how to behave and what risks they can take and what risk not to take. So with that, let me go to the next guest, Dr. Ken Carswell. So as you mentioned on the presentation, that many WHO tools are actually developed and designed for non-expert, non-specialist trained mental health helpers, but they are helped and trained by like other experts. So can you elaborate more on why it is important and why do you make that decision?
Yeah, sure. Thank you. I mean, I think the reason for making that decision is very much around not having enough specialists. So we need to find new ways of approaching people, providing services. Obviously, AI, like we're saying, there's massive potential there coming up. But there's going to be many areas where people are not connected, where we do need to we always need to have a human in the loop, but we're going to need areas where people can interface with people. So the whole idea behind it is about providing services to people at a bigger level. Now, in terms of the sort of design choices, when you do this, it's very much about taking what you know works and trying to simplify it for a non-specialist. So, for example, we've talked a lot about psychologists, but if we think about family doctors, we have a product called the MHCAP Intervention Guide, and it basically sets out in a sort of algorithm or series of checklists things that you need to identify. So if someone's got depression, certain symptoms, and then it sets out very clearly the types of treatments that you can provide. So a lot of it is about taking what we know and taking the core elements and trying to put it in a format that people can understand and access. I would say, though, that probably one of the biggest learnings for me over the last sort of 10 years, particularly working in the psychological intervention and digital space, is very much about the importance of both involvement of people with lived experience and adapting to the situation, which we've really always done. But I would say that the bigger learning for me is really around designing for the system. So thinking about where you're going, and we mentioned something similar earlier, like there will be areas where there isn't access, or there'll be areas where there's certain needs. And if you understand the system, you understand the people in the area that you're trying to design for, I think you can then get a much better end result. Because certainly some of the earlier work will maybe sort of made interventions that, even though they were simplified, they were still too big for some settings, whereas now we're working on things that are far more scalable. So I think that's a really important design choice and aspect.
Yeah, I think also to your point that the process of simplifying and extracting like the most core elements of this practice in itself, it can be a test of like how well we know this process and what works and what not works. So it is very clarifying. My next question is that, as you mentioned, like WHO's tools, a lot of them are deployed across nations, continents. And in terms of cultural adaptation, you very briefly mentioned earlier, from your practice, can you tell us what works best, what really not?
Yeah, no, certainly. Again, I think this comes down to the beginning product or the beginning intervention. So if you design something that is takes the core elements, you really try and get the core parts that work the most effectively and that can be most effective across many different populations. So if we take the example of slow breathing or stress management breathing, breathing is something we all do. It's something that, if you look across cultures, different cultures have different ways of managing sort of breathing. It might be through meditation, it might be through other aspects. So this is a core element that can work to reduce stress. And so we see that working across many different cultures. Something like, for example, in cognitive behavioral therapy, thought challenging. So the idea of identifying your thoughts, challenging your thoughts, that's something that might vary quite drastically across populations. So something like that is maybe a technique that you wouldn't include so readily as you would the sort of stress management aspect. So the first part is about design and thinking about the techniques that work the best across different populations. Then it's about talking to the populations, understanding from the people how they understand their world, how they understand mental health, stress, changing the language. So for example, we as professionals use the terms depression and anxiety. Most people, or many people in different cultures, use the term overthinking. So this is a common term that we see in many places. So we then got the language and sort of cultural adaptation to the population, and that has to come very much with the involvement of people. And again, not the involvement of people of just talking to a focus group, but really trying to involve them in the design and the adaptation. And I think one of the other important aspects is very much sort of expert-led top-down design, in the sense of from the research and the literature, we know the techniques that might work. But what we might not know is how we apply them. And that's more the bottom-up aspect. So it's about having help users and populations to help us understand how you take this core aspect, change it, and apply it in a very engaging way.
Yeah, thanks so much for the explanation. I think every AI mental health tools that develops and tries to being applied across different places need to learn from that. And personally, I really enjoy our conversations, and I think most of you do. But due to time constraint, I may have to wrap up our roundtable discussion. Let's give a round of applause to our distinguished guests.
Well, first of all, thanks very much for inviting me to this wonderful meeting, and I'm sorry I missed the most part of it. I got to, I landed in, to Geneva this morning, so literally, and then I sort of, had a quick shower and then got here. So unfortunately, I didn't have a chance to print out, but I was still revising it, the remarks I'm going to make, so I have to use my mobile phone. But really, I really know that, I'm now between you and the lunch, so I will certainly try to be brief. So good morning. It's really an honor to join you today at this very important gathering, focused on one of the most vital intersections of our time: artificial intelligence and mental health. For the last 10 plus years, I've been spending much of my time examining how emerging technologies, including AI, reshape our institutions, our societies, and ultimately ourselves. Nowhere is this more personal or more ethically charged than in the domain of mental health. We're living through a global mental health crisis, exacerbated by the lingering effect of the pandemic, social isolation, economic uncertainty, and now the psychological implications of our digital age. AI offers tremendous promises, from early detection of depression through speech patterns, to AI-enabled cognitive behavior therapy, to intelligent triage systems that help overstretched mental health professionals prioritizing their care. Yet this promises also comes with profound questions. Who owns the data as been discussed, gathered by our most private emotional expressions? Can algorithms trained on biased or incomplete data truly understand diverse human experiences? Will AI reduce stigma and increase access, or will it automate care in ways that diminish empathy and trust? They are not just technical or regulatory questions. They're governance challenges about how we design, deploy, and oversee AI systems in ways that uphold human dignity, protect vulnerable individuals, and promote fairness and accountability. let me offer three principles I believe that could guide our ways in this area. First, human-centered design. AI should augment, not replace human care. It should be a tool that empowers mental health professionals and patients, not a substitute for human connection. Second, transparency and accountability. The inner working of AI tools used in mental health must be explainable and auditable. People have a right to know how decisions about their mental well-being are being made. Third, equity and inclusion. Mental health is deeply shaped by our culture, language, and context. AI tools must reflect this diversity or risk reinforcing exclusion and misunderstanding. If we get this right, AI can help close the global mental health treatment gap, expand access to in underserved communities, and relieve some of the burdens carried by caregivers. But to do so, we need thoughtful governance, rooted not only in what is possible, but also in what is responsible. Let's move forward, not just with innovation, but with interaction, but with intention as well. Thank you. Thank you.
Thanks, Mr. Xuelan, for his powerful remarks. And that will mark the end of the morning's workshop. It may be the end of this workshop, but we all believe that as IHCA, we firmly believe that it is only the beginning of further future cooperation on health, on AI, and the projects. So I believe a lot of you are hungry. So for the guests who are also invited to our networking lunch, please find some of our volunteers who will guide you to the lunch venue. So thanks again. Please have a good day.